Okay, good evening, all. My name is Joan Towsey. I've been a member of the League of Women Voters of Champaign County for about 6 years. I'm a member of the program team, and I welcome everyone here, and especially welcoming our guest speaker for the evening, Will Schneider, talking about economic supports in child health and well-being. Will Schneider is an associate professor of social work at the University of Illinois at Urbana-Champaign, faculty director of the UIUC Children and Family Research Center, Kellner Senior Policy Fellow at the Institute for Government and Public Affairs, the Center for Social and Behavior Science, and current William T. Grant Foundation faculty scholar. Will received his MSW and PhD from Columbia University in 2016 and completed a postdoc fellowship at the Institute for Policy Research at Northwestern. He doesn't mention here, but I've picked up that he's also a Michigan undergrad, and that's where he met his lovely wife. So we'll say, okay, Will, you're from Michigan. We'll accept you here. His research investigates the role of poverty, inequality, social welfare policy, and child maltreatment and child neglect in particular. I've known Will for 3 or 4 years, as he was my next door neighbor across the street until Walt and I moved to an apartment a few weeks ago. Will and his family are a beautiful family and add a lot to the Champaign community. He has a son who's quite an accomplished ballet dancer, and look for the Schneider name at another Nutcracker this year, playing 3 or 4 roles or something, and phenomenal. So we do welcome Will. Look forward to hearing about his grant and his program. And please know that this is obviously being recorded. So if you find this particularly interesting and know people who are not able to attend, please lead them to the recording after it's been put up on our website. So with that, Will, please take it away, and thank you for joining us.
Oh, thank you so much and for that really kind introduction. I hope you won't hold it against me that I'm a Michigan alum, but split loyalty here. And thank you all for inviting me. I'm really excited to chat with you. So I'm going to share my slides here and tell you a bit about this project. So I'm going to talk to you today about a study called the EmPwR study, which is Empower Parenting with Resources. And the study is a joint project with some collaborators at the University of Connecticut School of Social Work and the Rutgers School of Social Work, and then with a large service provider here in Illinois called Brightpoint, formerly Children's Home and Aid of Illinois. And the project is funded by the Illinois Department of Children and Family Services, DCFS, our state's child welfare agency, and then the William T. Grant Foundation and the Doris Duke Foundation. So Joan mentioned the Children and Family Research Center, CFRC. So for those who don't know, CFRC is the University of Illinois' Child Welfare Research Center. It was established in the early 1990s via consent decree with the state of Illinois. So the ACLU sued, and part of that settlement was the creation of CFRC, which houses the DCFS administrative data and provides research support as well as some monitoring and oversight for the department. Okay, so I'm going to start off kind of defining some terms. So what is child maltreatment? Child maltreatment is a kind of umbrella term that makes up essentially 3 categories of parenting. Neglect, we generally think of as an act of omission or a failure to act that results in real or imminent harm to a child. And there are a lot of different types of neglect, primarily things like physical neglect, supervisory neglect, and then things like educational, medical, or other needed care neglect. Each state adopts a basic federal definition of what neglect is in order to receive federal child welfare funds, but definitions beyond that can vary by state. Child abuse is an act of commission, an intentional act that results in real or imminent harm to a child. And there are many types of abuse as well. primarily things like physical abuse, emotional or sexual abuse. And these are kind of the core aspects of what we talk about when we're talking about child maltreatment. Okay, so how common is child maltreatment? This slide often shocks folks. Each year, about 8 million children will be the subject of a child maltreatment allegation in the US. And it's a quite common experience for many children. My colleague at the School of Social Work, Hyunil Kim, has a paper estimating that about 37.5% of children will experience a Child Protective Services investigation by the time they turn 18. So you may hear me say CPS during this talk. I don't mean Chicago Public Schools, I mean Child Protective Services, CPS. And that lifetime prevalence varies a huge amount by race ethnicity. So about over half of Black children will be the subject of a child welfare investigation by the time they're 18, but only about 32% of white children, still quite a high number. And neglect makes up about 75% of all child maltreatment. So it's by far the most common form of maltreatment. And so the current project EmPwR study is really came about because of this slide. And I have been thinking about this slide since about 2016, and trying to figure out why. Why did the three trends you see here differ so much? You can see over the last 30 plus years, physical abuse has declined pretty dramatically, but child neglect has remained steady and high. And so we generally think of physical abuse and child neglect as kind of stemming from the same set of problems, as having the same etiology. But if this is so, why would these trends diverge? You know, one possibility is that there are changing norms around parenting. That, you know, in the early 1990s, when the American Academy of Pediatrics issued their brief saying not to use corporal punishment anymore, precipitated a dramatic change in how we parent children. And maybe this has led to a decrease in physical abuse. Or maybe it's evidence that our interventions are really working quite well for physical abuse, and so it's declining. I think the third option, and these things could all be happening at the same time, but a third option is that maybe neglect and abuse don't stem from exactly the same set of risk factors. Maybe neglect is more closely tied to poverty than physical abuse. So under the current model, we generally provide psychosocial interventions and parenting to treat both abuse and neglect because they're thought of as having the same set of risk factors, the same etiologies. So in that model, CPS, Child Protective Services, responds to a child maltreatment report. They offer family services like psychosocial interventions or parenting classes, with the idea that then parents have the resources to interact with children differently, to manage their anger, to supervise more effectively. But if neglect is more closely tied to poverty, then this set of traditional interventions may not provide all the parents need. They may still not have the basic necessities they need to provide what we call safe and consistent care for their children. And so if this is in fact what's happening, it may help to explain those diverging trends in abuse and neglect. And so this got us thinking, why doesn't the child welfare system provide cash supports to families? Why isn't this a standard intervention? And it turns out that a political scientist named Barbara Nelson wrote a very good book about this in the 1980s. And looking through the congressional record, she found that beginning in the 1970s, policymakers and the public began to be really concerned about child maltreatment. And this growing recognition that this was a widespread problem initiated the creation of one of the largest and most important federal pieces of legislation in this world called CAPTA, which is the Child Abuse Prevention and Treatment Act. And during that congressional testimony, there was a lot of testimony from experts about how poverty and neglect were linked. But Democrats on the committee feared that if they wrote a piece of legislation centered on poverty and anti-poverty policies, it would be vetoed by President Nixon. And so they decided that the act had to separate poverty from child maltreatment in order to pass. And so the result was the creation of a child welfare system that was parallel to, but siloed from existing social welfare programs. And it intentionally focused only on parental dysfunction and psychopathology as the cause of both abuse and neglect. And you'll notice that it's called the Child Abuse Prevention and Treatment Act. Neglect isn't in the name. It is kind of added in throughout the piece of legislation, but not distinguished as something that might be different from abuse in its origins. Okay, so that's a bit of background about the problem as we see it, the history of how we got to where we are in terms of how we treat abuse and neglect. And so I think the next question for us has been, what do we mean by poverty in the child welfare space? And as I've gone around and talked with state agencies, child welfare agencies about this question, I've realized that I think we're not all talking about the same thing when we talk about poverty. So it's not always clear what we mean by poverty in this context. For some, poverty is defined by the type of maltreatment. It's easy to see how something like unsafe housing or lack of food could be caused by poverty and might be considered neglect. And in some sense, that's defining poverty as on the outcome, saying, well, this type of neglect looks like poverty, so we're willing to call it poverty related. But I think maybe we should think about poverty and child welfare much more broadly. Poverty may directly cause neglect. You may not be able to buy the things your child needs, but it may also shape the range of good decisions a parent can make. And when you look into kind of popular media about this, what you find are a lot of stories about parents who get called in for late night, last minute shift work and are told essentially to show up or they'll lose their jobs. And so they're left with two bad decisions. They can not show up and take care of their children and be fired, or they can leave their children alone and hope that nothing happens. And we argue that that is a set of decisions that's shaped by poverty. It's not a clear case as it would be with something like you can't afford to buy your child a winter coat, but it is a set of circumstances that are shaped by poverty. And so for anyone who's a parent, this won't be a mind-blowing proposition, but we propose that all parents need both time and money to provide safe and consistent care. That if you have more money, you can use it to buy time. You buy childcare, you buy prepared food, you buy reliable transportation, things that middle-class families do in order to make the day work. If you have enough but not a lot of money, but you have more time, you can use that to compensate for the lack of money. So you might have one parent who stays home and cares for children instead of paying for childcare. We argue that when time or money falls short, child abuse and neglect becomes more likely through a range of possible avenues. There might be direct effects of these problems. There may be indirect effects, a scarcity mindset associated with poverty, co-occurring psychological stressors, and that without resources to address them, these very small problems quickly cascade into bigger problems. And so the question for us becomes, how do we increase time and money? And if we do, does the risk for maltreatment decline? So I'll tell you next about the EmPwR program. The EmPwR is the largest randomized control trial of the effect of unconditional cash transfers on child maltreatment among a child welfare involved population. So what we do know so far from the existing literature is that poverty is associated with child maltreatment and neglect in particular, that these two things move in tandem. But these studies are associational. We don't know if one causes the other. But more recently, there have been a number of studies that have used quasi-experimental methods. So these are not a randomized control trial, but they draw on some sort of outside change in a policy to assess the effect of that policy. So we know, for instance, that increasing the minimum wage is associated with lower rates of maltreatment, that more generous earned income tax credits are associated with lower rates of maltreatment and neglect in particular. And so too for things like expansion of Medicaid, more generous childcare subsidies, and TANF, which is our welfare program in the US. So a stronger social safety net, a more generous social safety net, reduces child maltreatment rates, and in particular, child neglect rates. But what we don't know, and which is really important for policy and for practice, is that there are no experimental studies so far of the effect of cash on child maltreatment. And so we don't know how cash might matter. We don't know who cash might matter for, and we don't know when to provide that cash. How much is needed, or for how long is needed to make a difference. And so these are the questions that EmPwR really sets out to answer. Okay, this is a complicated looking figure. I won't go too much into it, but I wanted to give a brief view of what the child welfare system in Illinois looks like. And so you'll see here that it begins in the allegation stage and ends essentially with either reunification or adoption, forms of permanency. And along the way, there are a series of possible pathways that a family can take. In Illinois, most services provided to families are provided by private agencies, not by the state. But most families do not receive services of any kind. Indeed, the majority of children who are involved with DCFS don't receive any post-investigation services. About 66% don't receive any services. Among those who do receive services, about 17% of children receive intact family services. And these are services where the family receives them while the children remains in the home, in the family of origin. And so this is the population we focus on because the children remain with their family of origin and can hopefully benefit from that family receiving unconditional cash gifts. So among intact families in Illinois, about 17% of all children and 21% of very young children who receive intact will be reinvestigated and substantiated within 12 months of enrolling in intact. And so there's a real problem here. Clearly, for some portion, a significant portion of families who receive intact family services, those traditional services aren't working. They are coming back to the system. And so as I mentioned, for EmPwR, we partner with Brightpoint, one of the largest service providers in Illinois, and they provide not only intact family services, but foster care, early childhood care and education, mental health and wellness services, and youth services. So it's a very large social service agency in Illinois. And so the basic premise of EmPwR is that if some portion of child maltreatment, and child neglect in particular, is caused directly or indirectly by poverty, what happens if we give caregivers involved with the child welfare system unconditional monthly cash gifts for 12 months? And so what we'll look at in our study is both the direct effects, this top arrow here, on a range of outcomes, as well as the pathways. So it may be that cash directly reduces child maltreatment, or it may indirectly reduce child maltreatment through a range of pathways, maternal stress or depression, more effective parenting. And then in the end, I'll tell you a bit about this last set of jumble of letters, the FFPSA, which is the Family First Prevention and Services Act, which is where we kind of hope to end our study. So we have a number of outcomes we'll look at in addition to child welfare outcomes. Things like co-parenting, child behavior, something we call time stress, physical and mental health, parenting stress, harsh parenting, parental mastery, material hardship, work, cognitive load, and discrimination. And we do this through a number of different methods of collecting data. So we began our study by developing and implementing a caseworker training on the role of systemic racism and poverty and inequality in child welfare. So you may or may not be surprised to learn that child welfare caseworkers are not trained about the role of poverty in child welfare system involvement. One possible reason is that they don't have a lot of concrete supports to give families. And so providing training about something you can't treat doesn't make a lot of sense. But we thought it was really essential for our project to provide that training to the caseworkers before we began. And so we did a series of focus groups about their perspectives, and then developed a training that we do with all new Brightpoint caseworkers about those things. And then we are randomizing about 800 intact families referred from DCFS to Brightpoint. We randomize on a rolling basis. So Brightpoint receives about 50 new referrals each month, and we randomize them as they come in. We do surveys with all families at baseline, 6 months, and 12 months post-randomization. And then we do a subsample receive qualitative interviews. So 40 treatment families and 20 control families are interviewed at baseline, 6 months, and 12 months. So our core questions here are, what's the effect of 12 months of unconditional cash gifts on child welfare outcomes drawn from DCFS administrative data at 3, 6, and 9 months post-randomization? Sorry, 3, 6, 9, and 12 months post-randomization. And we'll look at things like child removal, foster care, type of maltreatment, substantiation, meaning that an investigation found that there was maltreatment, investigations, allegations, and permanence. We'll look at variation by family characteristics, so child gender, geography within the state of Illinois, race, ethnicity, and child age. And then we want to know whether there's a direct effect of the cash transfers on take-up of services. So do families who get the money, are they more likely to make it to all of the parenting classes because they have the money? And does that have an additive effect on the money itself? And then how effective is the caseworker training on caseworkers' perceptions of the role of poverty and inequality in child welfare system involvement? And so the end goal of all of this, assuming that it works, and I hope it will, is that the intervention is designed to meet the approval criteria for the Family First Prevention and Services Act clearinghouse. So this is a federal clearinghouse established by the Family First Prevention and Services Act in 2018. And it's really the first piece of legislation that focuses on prevention of child maltreatment rather than the other end of the spectrum on foster care and adoption. And so it's a really important piece of legislation, but it says that to receive federal dollars, your intervention must meet the criteria of the clearinghouse, which means that it must have at least one randomized control trial evaluation, and it must be manualized. And so we have developed our training manual and implemented it, and we are now running our randomized control trial with the hopes that it will meet the approval of the clearinghouse. And then any locality, any jurisdiction, any state that wants to take up this program, EmPwR, will be reimbursed to do so. Okay, so I'll tell you a bit about the different aspects of the study and share some early findings. So the training manual it turns out to be a really important part of our work. I had kind of went into the study thinking about it as something that needed to be done for the clearinghouse, but it turns out to be a fascinating piece of this. So we began with semi-structured qualitative interviews and focus groups with child welfare caseworkers, supervisors, managers, and families. And we used those findings to develop a training and the training manual for caseworkers. So we did 9 focus groups statewide with 64 participants. And what we found was really interesting. Overall, what we found was that caseworkers were kind of readily able to recognize that systemic inequality and poverty exist, that these things were structural, but they were much less willing to attribute child welfare system involvement to those structural factors. In fact, they attributed it to individual level factors and actions. So staff viewed poverty as both structural and individual. And this created a real tension in their approach to families. There was a recognition of systemic discrimination and that families of color were much more likely to be affected by the child welfare system. I think really notably, they agreed that there were critical shortages in essential services, things like housing, childcare, mental health, and transportation that played a really large role in child welfare system involvement. But they had real hesitation about unconditional financial support to families, and they really feared misuse of that money by the families. One of the really interesting things to come out of this was that there were really varying perceptions within the organization by position. The higher ranks, so the supervisors and managers, were much more likely to show systemic thinking and much more likely to be excited about providing cash to families. So they kind of a tale of two causes. Caseworkers saw systemic barriers and families that had been trapped in poverty by those factors that were beyond individuals' control. But at the same time, they thought that families lacked agency, that they had settled into poverty and weren't motivated to leave poverty, and that in fact, the cash might help to trap them in poverty. Some kind of illustrative quotes here. I think people who live in generational trauma and generational poverty they don't necessarily see that there's another choice and that there's other options. On the other hand, I would say poverty impacts cases in the general group just due to the resources. Like I have a family trying to get therapy, but due to the fact that it's not in their area, they can't access it. Caseworkers feared the families didn't have the decision-making capacity to handle the unconditional cash, that they wouldn't be able to make strategic decisions about economic investments, and that they would need external guidance for financial choices. They wanted to restrict family spending, that economic support should only be justified when limited to basic needs, so families should only be allowed to spend the money in ways that the caseworkers chose, and that it should only focus on children's necessities. And they really viewed adult choices with suspicion. One of the most common things we heard was that parents would just waste the money. They would go and get their nails done, and they wouldn't spend it the right way. So, I mean, that's great, but what are they going to use it for? Like, are they really going to use it for what it really truly is intended for, as far as like helping them better their situation in the long run, or even the short-term situation? I don't believe so. I think they're going to say, great, I have this extra money that I can go out and buy my cigarettes that are really expensive, my alcohol that I really want to drink. But within the agency, these perceptions vary tremendously by staff role, which has a tremendous variance by education level and by salary range. So folks like managers who make between $70,000 and $80,000 a year were much more positive about the idea of unconditional cash gifts to families, and much more willing to accept that this may help counteract some of the structural forces that may result in child welfare system involvement for low-income families. I think one of the fascinating parts of this is that in our pre and post testing of our intervention, of our training manual, we really move many caseworkers into a kind of a greater understanding of the role of structural poverty and a much greater acceptance that families should and can be trusted to spend money as they see fit. So phase 2 is randomization, which we're currently in. We're doing what's called block randomization. So we are randomizing by region within Illinois. So each region gets a certain number of slots for randomization so that we aren't swamped by high population areas. We will consent and randomize all cases each month until we have 800 families enrolled. And families randomized to the treatment group receive an average of about $500 per month for 12 months, plus services as usual. And we vary the amount they get by family size and local cost of living. And so this is one of the ways in which we're really quite different from something like a guaranteed basic income study, where everyone gets the same amount of money. We are social workers and we care about equity. And so if you've got 2 kids in Chicago, you'll get more money than if you have 2 kids in Champaign because the cost of living is higher there. The monthly cash gifts are automatically refilled via a study-branded MasterCard debit card that we send the families. And families in both conditions are linked to the Illinois DCFS administrative data. So in addition, we're doing this qualitative sub-study, and the goal really here is to find out how families perceive and use the cash, the role of poverty and structural racism in child welfare involvement, and the effects of the cash gifts on family functioning. And so I've included here a couple of quotes from some of our families from the sub-study. So this is from Mariah. Mariah is a single mother who had her 10-year-old daughter at the age of about 15. Mariah has been homeless at least twice in her life, and both times she found alternate living for her daughter. So she placed her daughter with family or friends. Recently, things shifted for her because she lost her apartment. She got a ticket and was in jail for 3 days when she couldn't pay it. At the same time, her apartment complex wanted her to bring in proof of income, and she couldn't. She was in jail. And then she had issues bringing in her proof of income after getting out of jail. And when she got home, she was served with eviction papers. She tells us she had to give her daughter to her aunt and give away all of her clothes and possessions. And so Mariah is an example, I think, of what we think of as small problems quickly cascading. Small problems being things where a little bit of cash might have stopped this escalation that leads to child welfare system involvement. She says, yeah, I couldn't pay the car note anymore because I was too busy putting more money into getting it fixed than being able to pay the car note, which I explained that to them. But they basically don't care. They're just going to take the car and resell it anyways. And yeah, that's the thing. The transportation to where my job was at, from a city in Illinois near St. Louis to the village in Madison County, that's pretty far. So basically, I lost my job after that. So through a kind of a series of small events, she gets evicted, she's unable to pay her her car note, as she calls it, and loses her car, and then can't make it to her job and loses her job. And so we think this is a kind of a clear example of a time, a place where a little bit of cash may have prevented the escalation of factors that lead to child welfare system involvement. And something clearly where traditional services, like a parenting class, may not solve the problem, right? Not really a question about effective parenting practices, much more a question about, are you able to, do you have the tools to provide the basic necessities that children need? Another example of this is Kaylee. And Kaylee is a single mother who has to work the 2 p.m. to 11 p.m. shift at a warehouse for a big box store. She homeschools her daughter because of past bullying at school. And Kaylee used to have a stable babysitter for her daughter, but the babysitter quit recently out of nowhere. Kelsey often has to leave her daughter alone while she goes to work. And one day, her daughter left home and told kids on her block that she'd been left alone. And a neighbor called DCFS. And so she says, right. And that's the other end of that as well. It's not a lot of childcare runs till 11 o'clock at night. So even if I were able to find something I could afford, what hours would that be? And then what would I do from there? And I've had people suggest maybe I should work the morning shift. The morning shift at my job starts at 4 in the morning. So it would literally be the same issue in reverse. What childcare place opens at 4 in the morning? And it's tough, like I said. I have a pretty decent job now, but I'm a single parent with a single income and a pretty full house. So it's tough because pretty much I get paid weekly, and every week about 90% of my check goes to bills and household needs. And after that, I don't have a lot of money left over. So I can't really do things like I really need a new pair of shoes. My shoes are starting to fall apart, but I can't really afford to do that right now. So things like that. But I always make sure that I prioritize the things we need. So no matter what, I make sure we have those things. But other than that, yeah, pretty much my needs will always come second. So here again, a mother who faces what might be thought of as a small problem. How do I pay a babysitter to stay until 11 o'clock at night, but who can't afford to meet that need, right? And traditionally, this may not be thought of as a poverty-related case of child neglect, but maybe we really should be thinking of it that way. And if that's the case, then we need a new set of tools to intervene. Domestic violence is really prevalent in child welfare cases, although there's fairly limited research about it. In Illinois, as in many states, allowing a child to witness domestic violence is considered neglect on the part of the parents. And so this is Jolie at her 6-month interview with us. Jolie is 46, and she lives with her husband, Mike, a veteran, a daughter from a previous marriage who was 13, and a daughter with Mike who's 7. Jolie's been on her own since she was 18. She and Mike have lived in the same neighborhood for 10 years and both work full-time. But despite this seeming stability, Jolie and Mike have a tumultuous relationship. They both drink too much and they fight. Fights that often become physical and which their daughter often witnesses. They've been involved with DCFS at least 3 times before. The last time, Mike drunkenly sent a video of Jolie yelling at him to his brother, who called the police. At our baseline interview, Jolie and Mike both had enrolled in services. But Jolie, although she was unwilling to leave Mike over the abuse she was experiencing, expressed a lot of worry about their relationship and what exposing the girls to it would mean for them. At our 6-month interview, things had gotten worse. Mike had gotten into a terrible car accident, and caring for Mike and the insurance claims and other costs, Jolie had been fired from her job, and they'd had their power and water cut off when they fell behind on bills. And Mike's abuse, unfortunately, has only gotten worse. So Jolie says, close your mouth and open your ears. Close your mouth and open your ears. And I always listen to him. I don't even know who I am anymore. I really need to, I just have to do something different. I don't know what it is, something that makes me feel good to show my girls that life isn't just shit. When we asked Jolie how she spent the money from EmPwR, she tells us that in fact she hasn't spent any of it. Rather, she's taken the debit card and she has stored it in the freezer, hidden from her husband. And she tells us that it's just in case me and the girls have to go. I will cross that bridge when I get to it, and I need that money to cross that bridge. Then I think the other part of this is thinking about what money can do. So this is Katie's story. Katie lives with her 11-year-old daughter, 3 adult cousins, and their 2 children. She got pregnant with her daughter when she was in high school and has had a rocky relationship with her daughter's father. Like almost all the parents we talk to, Katie receives LINK, which is what Illinois calls SNAP, food stamps, and Medicaid, and has tried to receive other benefits, but has often found the enrollment process difficult to navigate and nearly impossible to get the benefits she needs. Katie tells us at baseline that she'll use her EmPwR money to buy household essentials, but that she'll also use it to buy quality time with her daughter. She says, but there's times that I do fall back because I don't know if it's right now. I'm looking for a bigger place. And I'm trying to save up as much money as I can because the place that I'm at right now, I'm currently in the process of calling the city because there's a hole in my ceiling that the landlord was supposed to come fix and never did. And it leaks and I have a slumlord. When we ask her what she'll use the EmPwR money for, she says probably household items like toilet paper and dish soap and garbage bags, and probably go do a mommy-daughter day. And talking about her daughter, she says she wants to get her nails done. So to take her to the nail salon to get her nails and toes done, get her hair done, I think it'll impact her a lot because now we can do more mommy-daughter things, something that I wasn't able to do before because of me being low on funds and me having to put everything towards bills. She doesn't even know it. I have it yet. I'm trying to surprise her. It's going to be a big surprise for her. And so in some ways, this is exactly what the caseworkers feared, that it would be money that wasn't spent on paying off debts or bills, but money spent on things that they, before our training, perceived as frivolous, but in fact may be really important for family functioning. The ability to pay to spend quality time with their daughter getting her nails done, or as many other families say, they're not trying to go to Disneyland, they're just trying to take their kids to the zoo or the movies to build experiences that they feel other families have, but that they haven't been able to provide for their kids. The last piece of our study is our surveys. And so we're undertaking survey data collection with treatment and control group families, designed to assess the effects of cash gifts on child and family well-being. So that we think here the cash may directly affect those things, and those things may in fact directly affect child welfare system involvement. What we find here is that although we don't test for being low income to be eligible for our study, it's any family that receives intact, families are quite low income. Only about 50% are currently working, although 80% have worked at some point in the past. Personal income, again, is quite low. Many families report making less than $5,000 a year, although a range make around $30,000 to $40,000 as well. Families also have huge amounts of debt. So we've excluded here things like mortgages. This is really household debt. And you know, nearly 25% report having $25,000 or more in debt. And so in thinking about this, you know, traditionally we think when low-income families get money, they should the proper thing to do is to spend it on paying off debt, and you know, paying off your credit card bill, buying household necessities. But in some ways, for many of these families, $500 a month, paying off $25,000 may not be the optimal choice, right? It may in fact make more sense to take your kids to the zoo and to buy some household essentials, knowing that that $25,000 with an extra $500 a month is really not going to make a terrible amount of difference. And families in our study are really remarkably good at knowing which bills have to be paid when and which can be floated so that they can make ends meet across different responsibilities. I think some of the last things I'll show you here are parents' perceptions of their parenting skills. So parents report quite a lot of what we call parental mastery. They see themselves as quite good parents and talk a lot about their investments in their children and how much they care for them. And they don't report a lot of stress. And this was somewhat surprising to us because their lives are quite complicated and they have a lot of financial stress. And I think one of the things we've come to understand is that the level of stress is pretty constant. And so no single event causes a spike in stress. Having your water shut off is something that happens. And so it's not particularly stressful. It's kind of life. The last thing we'll do is look at spending. So the debit cards we use allow us to see where the families swipe their cards. So if a family goes to the ATM and takes out all their money, we don't know where they spend it. But if they swipe it at a store, we know the name of the store they went to. And what we find is overwhelmingly families are swiping their cards at grocery stores, places like Walmart and Target, at gas stations, and then at fast food and restaurants, places like McDonald's and Dairy Queen. So I think in some, many of the parents in EmPwR live on the knife's edge. They've learned which bills can be put off so that they can buy groceries, which family members can be trusted to come through in a pinch. But for many, a small crisis quickly cascades into much larger problems, which end in involvement with DCFS. Things like unstable employment, shift work, high cost of childcare, medical care, and housing are real barriers to getting services and social welfare benefits that also often precipitate DCFS involvement. And I think really importantly, poverty often co-occurs with traditional risk factors, things like mental health and domestic violence and substance use. And so we don't argue that anti-poverty policies can replace traditional child welfare policies. in essence, we argue that anti-poverty services are a missing part of the caseworker's toolbox. And so I think things to think about here for us, for all of you, thinking about the federal political climate and how it's affected child welfare and whether we think it will. In Illinois, very much used to be a leader in child welfare innovation, and I think the current DCFS administration very much wants to be and has made some real strides. I think families are struggling, and cuts to the social safety net will likely exacerbate this problem. And so thinking about what we can do. Even in Champaign, we've seen some big changes in food stamps and Link. And so we're likely to see things like surges in food pantry use and how we as a community can respond to that. Real shortages in affordable childcare. And then thinking about ways we can encourage corporations and businesses to acknowledge the importance of childcare and things like advanced notice for work scheduling, so parents don't have to scramble to find care for their children while they're at work. And I think just last to acknowledge this is a big team. Myself, Meg Feely from University of Connecticut, Emily Bosk from Rutgers, and Marie Guerin from University of Connecticut, our wonderful project director, Alexis Cronus. Melanie Naden was our postdoc. We have a new one now. And then about 7 or 8 undergrad and master's level research assistants who are on the project as well. So I think I'm actually 2 minutes before I plan to be on, and I would love to take any questions and chat with you all. And so I'll stop my screen sharing here.
Well, thanks very much, Will. I think a lot of us have learned a lot about this issue that we may not have encountered ourselves or been as familiar with. I haven't been able to see all the questions, so I'll let some of the others address the questions that have come in from you all. But I'll maybe start by saying, asking a question about housing, harking back to last month's program. Although Will may not have seen our program that Peggy Patton did so well with Ben Leroy. Will in fact knows Ben, so I'm sure he's familiar with some of the work he does. But how does housing affordability factor into the poverty issues, particularly as you've maybe come across locally, and your thoughts on maybe improving some of that issue as well with the cash program?
Yeah, it's a great question. So I'm going to answer it kind of in 2 parts. So I think housing does play quite an important role. Dr. Hunil Kim and I have a study forthcoming in Illinois looking at the effects of, the role of evictions in child welfare system involvement. So that just got accepted at a journal a couple of days ago. And we do find strong associations between eviction and child welfare system involvement in Illinois, particularly in rural areas where you can imagine the housing stock is less available, less affordable, and less easy to move into places like emergency shelters. So I think affordability plays a really important role for families. Families in our study are often doubled up with family members, often with family members they don't want to be living with and who they view as a risk to their children, but they have no other options. I think the other part of that answer is that in Illinois, families involved with DCFS are often eligible for what are called Norman funds. And Norman funds are something that your caseworker can help you apply for. Where the DCFS will pay a security deposit and a first month's rent for you on an apartment, and they will help you. They will pay for household essentials like a bed and pots and pans. And this is a hugely important program that is really benefits families in a range of ways. And I think an expansion of something like the Norman funds would really be critical to families, especially as we potentially face harder economic times.
Thank you. Emily, Ann, or Karen, can you address some of the other questions?
Yeah, we had a question about the control groups that were used in the study that you're conducting right now from Peggy Patton and Todd Kinney. Does the size of the cash payment matter? It sounds like you're adjusting it for Chicago and other areas where the living would be cheaper. I guess they're trying to figure out how did you determine that amount that's on average $500? And then is the control group also getting a cash payment of a different value or just no cash payment at all?
No, yes, it's a great question. And I have a feeling that you may have read some New York Times articles about babies' first years and thinking about this. So babies' first years is a large unconditional cash transfer project run by Columbia University and Wisconsin, and a number of places. And they gave families about $330 a month, all families, and across a number of different locations. And they found so far pretty limited results. So we actually started off thinking that we would just replicate what Baby's First Years was doing, and we would give everyone $330 a month. And then as we thought about it, we thought that this didn't seem like enough money, and that the cost of living would really affect the outcomes. So one of the reasons why Baby's First Year may not have found effects is that $300 in New York City is really different from $300 in their other sites like Nashville. And so it's possible that there were effects in Nashville, but it was washed out by the effects in New York. And I think this is an example of DCFS being a really amazing partner. So we went to them and said, we really want to give more money to families, and we don't want to do what we had initially told them, which was 6 months of cash. We want to do a year of cash. And they said, yeah, if you think that's the right thing to do, then you should do that, and we will fund it. And so, I'm so grateful for the DCFS partnership. They've been really invested in the project. So the answer, I think, is that we picked $500 because it seemed like a reasonable amount of money. We don't think of ourselves as a guaranteed basic income study. We think of ourselves as a targeted, time-limited cash supplement, essentially a cash intervention. And so we're not trying to reach a threshold that replaces income. We're trying to smooth those moments of crises so that they don't cascade into bigger problems.
Okay.
But the control group, did some get nothing and then?
The control group does not get cash. They get incentives for filling out our surveys and for participating in the qualitative interviews, but they don't get the cash gifts.
Do they know the cash gifts are happening elsewhere?
They do.
Oh.
Yeah. Yep.
Must be interesting.
They are, I think for the most part, families they're disappointed to learn that they won't be getting the cash, but they are really invested in being a part of the study. Families really, so far, have enjoyed feeling like they are part of something.
Cool.
And they will hopefully be making things better for other families.
I have a question about the connection between the child tax credits during the pandemic for the relief money. Obviously, reporting is different if kids aren't going to school and teachers aren't seeing kids and that kind of stuff. But what, if any, are some of the takeaways from that influx of cash for families who have kids? Is this at all relevant to what you're doing here?
Yeah.
Ways that are significant, or is it too hard to tell with everything being different during the pandemic?
Yeah. So it's a great question. So during the pandemic, we had the expanded child tax credit, which gave most families money each month from the federal government, and it dramatically cut poverty, right? It reduced poverty among Black families by almost 50%. At the same time, as Emily notes, most child welfare allegations come from a pretty limited set of mandated reporters, teachers, law enforcement, and medical personnel. And those folks really weren't seeing children. And so we saw a drop in child welfare system involvement, but we can't really say it was because of the money, because they just weren't being seen by folks who usually do reporting. About 70% of child welfare hotline calls come from teachers. And there's other work, particularly by Kelly Fong, who'll be a speaker on campus in the spring, I believe, that shows that teachers often call the hotline, child abuse and neglect hotline, because they are looking for help for kids, not to have them investigated and potentially removed, but because they notice that a kid doesn't have a winter coat and they're hoping that DCFS can get them one, not realizing that's not really what DCFS does.
I I have a question. Kelly Fong is here November 19th, first of all, EmPwR has said, so.
Sorry, Wen.
Sorry.
I should have known that.
And this question may be addressed to Wynn, a former dean of the School of Social Work as well, but I'll ask Will. How does the Illinois social work program, how are students prepared now to handle problems around neglect, maltreatment, and poverty? You kind of noted earlier that a lot of social workers are not connecting the dots there, but how are we preparing our students to do so?
That's a great question. I think through a number of factors. So we, have some core child welfare courses at the School of Social Work that do touch on these questions. I think at the school we really value experiential learning, and so we've got lots of students who work in our various labs. So work on my project, work on projects by Dr. Garth and Kevin Tan and others. So I think it is part of the curriculum, thinking about structural poverty and inequality. And then it goes beyond that, right? How do we make an impact in our communities?
And maybe building on that for just a moment, and I know having worked in the College of Education, this is an issue as well. How do we encourage more men to go into the field?
It's a good question. Well, I think, as AI replaces all of our work, this kind of work will be what's left, right? Work where you need to see people and talk to people and interact with people. Well, I think increasingly this is going to be the jobs of the future, right? Jobs that can't be done by machines or outsourced are really things like social work and medical care. And I'm hopeful it continues to grow.
Jane?
Is this connected at all with the Doris Kelly Christopher Family Sustainability? I don't know what to call it, department or building or Family Resiliency Center, I think it is.
And
Yes.
ACEs.
Yes,
Sorry.
and ACEs. No, we're not.
Okay.
Yeah.
Emily, are there some other comments or questions?
Yeah, there was
Yeah,
another one from Peggy and Todd about the cash payment approach being sustained. So this study looks like maybe $250,000 just in the cash payments to those 40 families alone. What's the sustainability or scaling up possibility looking like at this point? Obviously, it's still a case study, but what
Yeah.
happens to participants after the 12 months? Is it just cold turkey, $500 per month to zero?
Yep.
And in the future, what would that funding possibly?
It's a great question. Yeah. So yes, the money does end after 12 months. And so the participants get a lot of kind of education about not taking on a whole lot of new financial responsibility because they're getting the cash. We tell them, you're getting this, but please don't go out and sign a really expensive lease. This cash will end. Starting at 8 months, we send them text messages every month reminding them how many months they have left of their cash, so that they can plan ahead. But then it does end at the end of 12 months. In terms of sustainability, we hope to find that it works, that families are less likely to come back to the child welfare system, less likely to be investigated or removed. And then we really hope that the path forward after that is approval by the clearinghouse, the Family First Prevention Services Act clearinghouse, which would mean that if Illinois wanted to do this, to do EmPwR on a broad scale, the federal government would have to reimburse them for giving families cash.
And then there's
Karen?
another follow also.
Yes. Sorry, Karen, did you want to say something?
No, I was just gonna say, but I think Emily's gonna read the
Okay.
question, so we.
Take it away. I'm on mute.
Go for it. No, go ahead. I'll just say, Peggy also asked, how does one access the Norman funds, and are they specific to Illinois?
The Norman funds are specific to Illinois, although other states have some variation on it. Generally speaking, the caseworker helps families apply. And there are some policies and regulations around it. So typically, Norman wants you to be able to prove that you can pay the rent for 3 months after they help you get the apartment. But I would say that they are quite generous and really want to help families get housed. So I don't know that there's a way for families to apply directly. I think it has to be through working with a caseworker through a child welfare investigation.
Is that an acronym for something, Norma?
No, it's also the result of a lawsuit against the state. So it was the name of the court case.
Norman Emergency Cash Assistance and Housing Locator Service Information. Somebody's given a link.
Okay, great. Perfect.
Cool.
Anything else, Emily or Karen, that you've seen that we haven't addressed here? If not, well, I want to thank Will very much for his presentation and informing us about this very interesting and unique program. Our next Keeping It Local program will be November 19th, when Julie Pride from from the Public Health something or other, Champaign County Public Health Department will be here, and we can send questions ahead of time. I think everyone receives some of that information who's a member. So we look forward to seeing Julie, but let's all give Will our thanks and appreciation. And if there's nothing else, we'll say good night and keep warm.
Thank you.
Thanks.
Thank you all so much.
Thank you.
Thank you.